Topic that we would start is central serous retinopathy. Very important for AIMS and the All India exam. So basically, it's a type of choroidoretinopathy. So not only the retina, but choroid is also involved. Okay. So how the patient would present? So normally it would be a young male patient with a, let's say, type A personality. He may be a computer engineer or software engineer who is always under pressure, and he says that acutely he is finding a central scotoma or blurring of the vision. So these are the main clinical features or the clinical characteristics, or I would say the presenting features of the patient who is having a central serous retinopathy. Also, the risk factors are use of steroids or ATT. Remember, there is no loss of vision, but definitely there can be diminution of vision in massive central serous retinopathy. Another important thing that you should remember is that there is a hyperopic shift. So what is the meaning of hyperopic shift? Let's say the patient is wearing a spectacle with a correction of -2 diopter sphere. After the CSR, he gets it at, let's say, -1 diopter sphere or 0 diopter sphere. Or if the patient is emetropic, let's say 0 diopter, he goes to +2 diopter. So this means that there is a hyperopic shift. Now, as you can see in this figure, can you see this diagram? So here, can you see the halo? So this halo is basically the edema that is coming, and there is a serous detachment. This picture is the OCT picture, and if you can see, there is splitting of RPE. So this was also a AIMS question, that there is a splitting of RPE and the serous fluid that is accumulated in the region of fovea. And on FA, can you see this pattern? So there are two patterns that you can see on fluorescein angiography that can be asked in your exam. One is an Inglot pattern, or there can be a smokestack pattern. So what happens in smokestack pattern? It is almost like if you can remember this figure, so there can be like a leakage that is seen above the macula. So this can be a smokestack pattern. This is ink blot pattern. So what is the treatment? So normally you don't need treatment, and these patients get resolved in 3 months time. You just have to counsel the patient that okay, this has happened, but the fluid would automatically get absorbed. So but if it is not getting absorbed, or if the patient is the one-eyed patient, what we can do is we can do a fluorescein angiography and we can laser the leaky areas. Or you can do a grid photocoagulation like you do in the case of the CSME. You can similarly do a focal grid photocoagulation. The new treatment modalities are aldosterone, that is also being tried, and photodynamic therapy. So these are some important points that you should remember regarding the central serous retinopathy.